This is my best friend, Dr. Dawn Goldstein, and she is a doctor. She is an OBGYN. She is a baby expert, just like I am. And you guys are in for an amazing treat. Right, Dawn?
Thank you.
Thank you. This is a person who never runs out of things to say.
Well, you're my best friend. You have to say that about me.
I actually don't have to say it, but I do mean it from the bottom of my heart. And you know what? There is probably a bunch of you in the chat room, and I see them now. They're all saying hi to you. They're all saying hi. And I know that Dr. Goldstein, Dr. Dawn's patients are in the audience too. If you are one of her patients, you can say hi to her right now too. A lot of you see both of us. You see Dr. Dawn, you see me. Oh, somebody said I had a haircut. Yes, I got a haircut. Thank you for noticing. It's a little shorter than I expected. We were just talking about it as we went on. Yes. Thank you. Yes. And so Dr. Dawn is here with us, and I'm just really, really excited. It's been almost a year since we've been doing the show, and she's been one of the people on my list who I've been waiting to have on. And so most of the time when I try to have her on, she's so busy. She's on call. She's running in, doing a delivery, and I get very nervous because I think, she's going to get called out in the middle of the show. And by the way, she has her phone right here with her just in case anybody decides to go into labor. You got anybody like ready to go right now?
I do.
You do?
I
okay.
have a couple
Hey,
people
listen,
ready
if
to
the
go.
phone rings, you know,
We'll
Judy
answer it.
calls. Judy calls. We may have to answer for the first time, right? The topic tonight is how to have the healthiest pregnancy possible. And I just thought, you know, between an OBGYN and a midwife, you're going to be able to get some really good information from both of us. I mean, we just have so much that we can offer you, and I thought this would be a great topic for us to do together.
Yeah, we have a lot of combined experience.
A lot of combined. How many babies have you delivered?
Oh my goodness, I don't know. I've been doing this for over a decade.
Over a decade, yeah.
Lots,
Long time. I would say
thousands, yeah.
between the two of us, we have about 20 years, at least 20 years of experience in delivering babies.
Oh yeah.
Yeah, and probably several thousand.
Probably
Yeah.
so, yeah.
You know, it's a good combination. We can get together and talk shop at times. You know, I haven't done it for a long time, but now you just send them to me when they have a breastfeeding problem. Right?
But it all comes back to you. It all comes flooding back to you when we talk about it.
It does come flooding back. It's something that it's hard to forget. You know,
Right,
being with
It's like
pregnant moms.
riding a bike.
Exactly.
You can't forget it.
You definitely can't forget it. Except the only time that I do forget it is when I was pregnant myself.
Same here.
When I was pregnant myself, I was a total idiot. Like, I just literally didn't know anything. Joe and I used to have to play this game during pregnancy, which was, you know, call the doctor, call the midwife, because they're all going to laugh. Like, I could not diagnose anything on myself, even the most, you know, non-complicated problems, even the most normal things that occur during pregnancy. If I had any pain at all, my mind would go to the worst possible scenario. And we would play this game where I would go ring, ring, and Joe would call up and talk to me like I was the midwife and tell me what the problem was. My wife is having this pain on her left side. What do you think it is? And then I would ask him all these questions as if I was the midwife. And then I tell him, she's fine, don't worry, it's totally normal.
Right.
But I had to take myself totally out of the picture to be able
Right.
to do that because, you know, you guys know what it's like when you're feeling something and you're pregnant. You know, don't you hate that when you have a pain during pregnancy and your doctor says to you, that's normal? And especially from a man, right? When a man tells you, well, that's just normal, and you're going, yeah, but this really hurts. Like, how could this possibly be normal? Anyway, I know that feeling. All right, so let's get on with some of our topics tonight, because we have a lot to discuss, all right? First of all, I want to tell you about our sponsors. Our sponsors tonight are Viacord, and Viacord is one of the leaders in the cord blood banking industry. This is about saving your baby's stem cells after delivery. Both Dr. Dawn and I did that with both of our children, all of our children.
Yes.
All four of our children.
combined children.
All of our combined children. We did save our stem cells, and I'm a big advocate. Most of you know that I really do believe in saving stem cells. I can't say. I know what I want, but I can't say it. Saving stem cells for your baby, and Viacord is just great because it's a national company. They're owned by Perkin-Elmer. They do all the research out there. It's fantastic, and I just love working with them. I've been working with them for a really long time, and you know, they're using stem cells now for about 80 different diseases, which is amazing. I mean, 9 years ago when I first saved stem cells for my children, I mean, there was like only 8 or 9 diseases on the list. It was like leukemia, lymphomas. Now, I mean, the list just goes on, and I think to myself, you know, 20 years from now, or even 10 years from now, I mean, that was only 10 years ago.
Absolutely.
What are we going to be doing with those stem cells? And it's really so inexpensive these days, like less than you think it is when you really break it down into the payment plans that they give, and Vicord is great with that.
I look at it as an insurance policy.
Absolutely.
For not only for your baby, but for all the family members,
Yep.
for which it could be a really good match.
Absolutely. I actually had a client who had twins and used the stem cells for her husband when her husband developed cancer. And it's just like, you just never know. You just never know. All right, so let's start talking about our topic, okay? We've got a lot to cover here. The topic tonight is healthy pregnancy. And Dr. Dawn and I got together yesterday, and we started to think to ourselves, like, what are the main things that people really need to know if they're either pregnant right now, like an early pregnancy, or they're considering a pregnancy soon or sometime in the future. Like, say you have a baby right now and you're thinking at some point I'm going to want to get pregnant again. What are the most important things that you need to know preconceptually and also during pregnancy to have a healthy pregnancy? Right? And some things we're going to talk about you may already know, and then other things may be a little surprising or something new that you've never knew. Right? So let's start, because, you know, I think the place to start is with preconception, because a healthy pregnancy does not start once you get a positive pregnancy test. Isn't that right?
Absolutely. There's really a lot of ways that you can prepare your body for pregnancy and prepare yourself,
Yes.
you know, in a complete way for pregnancy. And, you know, I would start out by saying that, of course, I would say this because I'm an OBGYN, but I think that it's a great idea to make an appointment with your provider and go over all of the things that you can do to optimize your pregnancy outcome.
Well, there's so much blood work that you do early in pregnancy that you could do beforehand, that if there was an issue, now you can actually do something about it.
Well, yeah, there's things that, you know, like if you're not immune to certain diseases, you can actually get vaccinated prior to pregnancy. And if there's a genetic issue in the family, you can be tested for certain genes.
Absolutely.
So it's great to have a preconceptual visit. I love to get people before they actually are pregnant and optimize their health. It's a good idea to get to an ideal body weight.
Yes, that's true.
Difficult to do,
yes,
but very true. It's good to exercise beforehand. It's good to take vitamins and really build up your nutrient stores so that you have enough folic acid on board. You want to take 400 micrograms of folic acid, if you can, 3 months prior to
you want to consider it like preconception, sort of like the the pre-trimester.
It's
kind
trimester
of 3 months.
zero.
Yeah,
it's
like
trimester zero.
the trimester before you actually conceive.
Exactly.
And the folic acid, because we all kind of, or I assume that most people know that they should be taking folic acid prior to pregnancy, and then also through pregnancy itself, but especially in the early first trimester. But that folic acid, what exactly does it do for the body?
The folic acid is very important to prevent fetal malformations, specifically neural tube defects like anencephaly or spina bifida.
Right.
And in short, you really need to build up the folic acid stores before pregnancy, because what happens is at conception, the zygote starts dividing, it becomes an embryo and becomes a fetus, and all during that first trimester, the baby's forming, all of the baby's parts and the organs are forming and the systems are developing, and you want to make sure that the neural tube closes properly.
Yeah, and a lot of people don't realize that the most critical time of the whole pregnancy is actually the first trimester, and usually even before you know you're pregnant.
Yes.
Yeah, which is kind of, you know, one of the reasons why it's important to try to plan this, you know, obviously not all pregnancies are planned. Sometimes it's just like, oops, I didn't even know I was pregnant. But if you can plan the pregnancy, it's really important to be able to, like Dr. Dawn said, be able to take the nutrients that you need beforehand, and then also, you know, to be able to avoid medications early on during pregnancy, to make sure that you're eating right, to make sure you're taking your folic acid, because that's the time when the brain is forming, when the heart is forming, all the major organs are formed by 8 weeks. Isn't that true?
Yes.
And that's only 6 weeks past your past ovulation. Right? So it's 8 weeks from your last period.
Right. So when you have a positive pregnancy test, it's 4 weeks from your last period. So
Exactly.
it's very early on. So ideally, in a perfect world, which doesn't
Yes.
always happen, but in a perfect world, certainly 3 months prior to becoming pregnant or while you're even trying to get pregnant, it's a good idea to, to do all these practices.
Absolutely, absolutely. When we talk about preconceptual planning, one of the things that comes up often, and I'm going to answer one of the questions here. Somebody asked a question about, let's see. Okay, this is a question from Kelsey, and she's from Indiana. And Kelsey wanted to know, how long should she wait after the birth of her baby to get pregnant again? If you get pregnant too soon after giving birth, what are the potential complications? So this is all about pregnancy spacing. So how long between pregnancies is the ideal time to wait?
The ideal time to wait in between pregnancies is approximately 18 months. And it makes sense because you're depleting all of your nutrient stores in your first pregnancy, and you want to really have time to get into your best shape, to get to your ideal body weight, and replenish the nutrients that were lost. In terms of what can happen if you get pregnant too soon is really the issue of having lack of nutrients and a low birth weight baby.
Yeah. So it actually, the biggest effect will be on the second baby, is that your nutrients are not built up, that, your baby could be born low birth weight, could be born prematurely. So the risk is highest for the second baby.
Right.
Right? But there's also, the whole idea, and I said to Dr. Dawn I was going to talk about this a little bit because my babies were 18 months apart from when I got pregnant when my oldest one was 18 months, which is what you were describing. And I remember for me, I knew that it was the healthiest time to wait, but it was also, I was done nursing at that point. I think I stopped around 13 months, and I just needed a little time between pregnancies for myself to get my nutrients back, to build up the stores in my own body, to feel like I was ready again. And it was around 18 months that I naturally felt ready again to get pregnant, and it worked out really well. The spacing between my children is 2 years and 4 months, and I feel like it was a really ideal spacing for them. I see people all the time who get really worried because they think they're older. And so they get pregnant, they have a baby, and then when the baby's like a month old, they're like concerned about maybe I should try getting pregnant again now.
Right.
And I don't recommend that at all. I mean, like, unless you're like 45 years old.
Right,
I mean,
right.
you're really, people talk about, oh, I'm 36, I'm 37, I should try to get pregnant immediately. It's really not good for the baby, for yourself, for your first baby. I mean, your first baby's still just an infant,
right,
and really needs you. And being pregnant, as you all know, it's tiring, and a toddler or an infant doesn't really care. I mean, they just don't care that you're tired. It's not the same with your second pregnancy.
No,
hold
not.
off a little bit. Hold off
not.
a little bit. Speaking of that, let's talk a little bit about age.
Yeah, because I get a lot of women that come in and they feel like, oh my God, I'm going to be 35 and this is the end of the world and I have to have my kids before I'm 35, and if I don't, then, sort of doomsday is coming.
Yeah.
And that's really sad that myth has been perpetuated. And what it's based on is that the risk of having a baby with a genetic abnormality, namely Down syndrome,
Yes.
is increased with increasing age. And the only reason that age 35 is used as advanced maternal age is that's the age at which the risk of having a baby with Down syndrome equals the risk of losing a pregnancy from an invasive test like an amniocentesis.
Yes.
So it's an arbitrary cutoff for advanced maternal age. And now with sequential screening, first trimester screens, and other tests, it's really an outdated concept. And the risk of having a baby with Down syndrome, though it does increase with age, most babies with Down syndrome are actually born to women,
younger moms.
Yeah, under 35, and that's a volume issue.
Yeah.
But the bottom line is that there are some slight increased risks of some pregnancy complications like diabetes and high blood pressure. But the benefits of replenishing your nutrients and getting in the best shape and getting as healthy as you can far outweigh the risks of having a genetic abnormality.
Yes. Somebody in the chat room was saying, can you say that again? And I think what Dr. Dawn was saying was that the reason they pick age 35 as the time when we consider it advanced maternal age is because it's the time when the risk of having a baby with Down syndrome equals the risk of losing a pregnancy to amniocentesis, right?
Right. So who do you offer invasive testing to? You offer it to women who are at risk, at a higher risk of having a baby with Down syndrome than they would be from a loss from the test. So that's where where the lines cross,
And what
that's the
it's
reason.
still only like 1 in 400.
At age 35, it's
1 in 400, right?
Yes,
And
that's
that
exactly
means
right.
that not everybody who gets pregnant is going to have a baby with Down syndrome, obviously. So it's
By far.
it's by far very, very small. The only reason that's the cutoff is because the risk of the test equals the risk of the issue.
Of the issue,
Right?
right? Exactly.
And then with every year after that, the risk increases slightly. But that's still, by 37 or 38, it's still only 1 in 200, right?
And by 40, it's about 1 in 100.
I mean, I have a lot of people who worry about they are considered high risk pregnancy, and that's not true necessarily until, you may decide you want to have the amnio, and once the amnio comes back normal, a person who's 36, 37 is not really considered a high risk pregnancy at that point.
Definitely not.
Right.
Definitely not.
So that's really good for a lot of people to know, because they walk around feeling like, this is all really scary. I'm totally high risk, and that's not the case. And I have to say that, more and more moms are having babies much older these
Absolutely.
days,
Absolutely.
And we're doing everything older these days.
Definitely. And I think it's a big problem, because I encounter this so much, and women are in fear. They come into the office in fear
Yes.
because of their age. And, to me, I really want the women to relax and to realize that
Right.
childbearing at a later age is the norm at
Right.
this stage.
That's right. I had my first one when I was 32, and then my second when I was 33 and 35, and it was great.
I was 34 and 38.
There you go. And I'm even considering it now, and I'm 42. Joe's eyes just lit up. He was like, really? You want to have another one?
More diapers to change.
I just want to do it right. I made so many mistakes. I want a second chance.
Well, you've replenished your nutrients.
I have definitely replenished all of my nutrients in the last 7 years, and then some, and then some. My folic acid stores are way back to normal at this point.
Absolutely.
We're cheering you on.
They're cheering me on.
You go.
They're cheering you on, baby. Okay. All right. So let's talk a little bit about what kind of supplementation would be the ideal thing that people should be thinking about, like when they're considering like vitamins, or what's important to look at.
Yeah, that's a good question. Women tend to think that they need to take a prescription prenatal vitamin prior to pregnancy. My feelings about a prescription prenatal vitamin is that they're fine, but there's no reason that you have to take a prescription.
Right.
You can formulate your own mixture of what you would like to take, and what you need to take is you need to take folic acid, as we were saying, 400 micrograms.
Yes.
And that would be in advance of the pregnancy by 3 months.
Yes.
Additionally, if you do have problems in the family or in the past
Yes.
with neural tube defects, anencephaly, or spina bifida,
That's why it's important to know your family history, and especially to mention that to your midwife or to your doctor when you go in for your first visit, either your preconception visit or your first pregnancy visit.
Absolutely.
Try to get as much of a
Yes.
detailed history as possible.
And there are some women who require more folic acid. So women with this family history, or if you are epileptic and on seizure medication, there's reasons to take more, to the degree of 4 milligrams from 400 micrograms. So it's a really good idea to know your status and know what your dose is for folic acid.
Yes.
And that needs to be taken all the way through the first trimester, really throughout the pregnancy. But the most important time is throughout the first trimester, as all of the organs are developing.
Yes. I actually like the non-prescription vitamins. There's 2 brands that I usually recommend. One is Nature's Plus, and they make a great prenatal, the ultra prenatal vitamins. They actually have more calcium, which I know you're going to talk about in a minute. They don't really get you too nauseous. So they don't make you feel sick after taking them. They don't have any kind of stool softeners in them or extra ingredients. And then Rainbow Light makes a great vitamin as well. They're 2 really, really good high quality vitamins. So if you're interested in taking something that's not prescription. Nature's Plus and Rainbow Light, 2 great vitamins.
Yeah, and the fact is that they're still prenatal vitamins, even though
Yes,
they're not prescription.
that's right.
Because if they're not prenatal vitamins and they're regular women's ultra mega, you just have to be careful because things like vitamin A, which is
Yes.
fat soluble and linked very strongly to birth defects,
Yes.
you can't have that in excess of 5,000 units.
Yes.
So you really have to check your labels, and I would encourage anybody to bring to their provider what vitamins they're already taking, and that way together you can make some adjustments in the vitamins.
Absolutely. A couple things that you really want to keep in mind is making sure that you have enough calcium. Your body definitely requires more calcium when you're pregnant as well as when you're nursing. It's about 1,200 to 1,500 milligrams that you need per day when you're pregnant, and then up to 1,800 milligrams when you're nursing. And so most of even the best prescription prenatal on the market is going to have about 200 milligrams of calcium in it. That's nothing nearly close to what you actually need to be taking in. So you want to either take another supplement of calcium, or you want to make sure that you're getting your green leafy vegetables, your calcium through good foods that are high in calcium, and we're not talking about dairy. If you go back a few weeks ago and watch the show, we're not necessarily talking about drinking a lot of milk, but there are better ways to get your calcium. And then there's also the whole concept of vitamin D, and this is something that I think is very, very little is known about vitamin D and the importance of vitamin D. I think Dr. Susan, was she on with us when we talked about vitamin D, or do we do that during we did that during the dairy show, the vitamin D? Yeah, I think we talked about it during the show, but
vitamin D is very interesting because there's a lot of research now that's going on in the arena of vitamin D, and I think that what's not known about vitamin D is what can actually really be harmful, because to be adequately treated with vitamin D, you really need to have your levels checked.
Yes,
and
it's very individualized.
It's very individualized, so you want to get your levels checked before pregnancy,
Yes.
ideally.
Yes.
And you want to know what your levels are because you want your level to be 50 to 80,
Yes.
definitely over 50.
Yes.
And so the general recommendations in the conventional medical community now are to take about 200 units of vitamin D, and the recommendations from studies done out of Britain and other places
Yes.
are that pregnant women need to take between 5,000 and 10,000 units of vitamin D,
Yes.
and
To
that's
get their levels
the levels
up
up
high enough
to where they need to be. Exactly.
Most of the population has levels too low in vitamin D, and
Right.
and you can understand that because first of all of our recommendations are too low for the daily intakes. Second, we're not getting as much sun exposure as we needed to get those naturally up, and we're all avoiding the sun, putting tons of sunscreens on,
Right.
and not able to get the vitamin D naturally that we would normally get from the sun. I would recommend, like Dr. Dawn said, is that you have a blood test done, and this is a test that you can have done. You know what the name of the test is that they would be looking for?
It would be 25 hydroxy vitamin D.
25 hydroxy vitamin D is the blood test that you would ask your physician to order for you, so you could test your level and make sure that it's at least above 50.
Right.
That's the ideal place. And like Dr. Dawn said, you may need to take very high levels of vitamin D in order to get to that therapeutic dose.
Right.
Where your levels are that high. It's one of the most important nutrients that you probably need during your pregnancy. It's been linked, low vitamin D levels have been linked to premature birth, to preeclampsia, which is high blood pressure, and toxemia during pregnancy. And so, one of the things that you can really do to be very, very healthy, or to increase your chances of having a very healthy pregnancy, is making sure that your vitamin D is well within the normal limits, which is above
Yes.
50.
Yes.
So it's one of those things that, again, perfect reason for a preconceptual visit.
Exactly. And, not a whole lot of research had been out in the
Yeah.
past about vitamin D.
Yeah.
So this is really new, and it's really on the forefront. So it's something that, that you can bring to your provider's attention, and your provider can look into it and see what your levels are and what to do about it.
Yeah. Definitely. And don't be surprised if a lot of your providers are not as aware of this information as they need to be. Again, like Dr.
Right.
Dawn said, it's new research, it's new stuff out there, and I would do a little bit of research on your own to just see what we're talking about, and then make the decision of whether you believe that this is the right thing to do. I personally, we're having our levels checked right now.
As we speak.
As we speak.
We have vitamin D levels cooking in the lab.
Because you actually need this vitamin D. You need it to just live a healthy life. It's good for your immune system. It helps in so many different areas of your body. And if you're nursing, you especially want to have enough vitamin D. They talk about if you get 1 to 2 hours, in order to get those levels without the supplementation, you would need 1 to 2 hours of direct sunlight per day of unexposed skin. Now
those of us who work indoors are not really getting
if you're
that kind of
sunbathing
exposure.
for 1 to 2 hours a day, which is probably not good because of the sun exposure, you probably need to supplement it
Right.
with a good vitamin D. I take it in the form of liquid, and I put it in a shake,
Mm-hmm.
and it tastes really good, and get my vitamin D. Okay, let's talk a little bit about infertility. How do you know? Okay, so you've been trying to get pregnant, okay, and it's not working.
Okay.
Like, how would you know this is a problem?
Okay, so basically if you're having regular menstrual cycles
Yes.
and you are ovulating, then the chances of getting pregnant each cycle when you have timed intercourse correctly with your ovulations
Yes.
is 20%.
Yes.
So 20% chance each month.
Yes.
By 1 year, 80% of couples are pregnant.
Yes.
So that's sort of been chosen as the landmark of when to get worried. Now, my feeling is that if you have a concern about your fertility, whatever that concern is, or if you're feeling, even if you just have a feeling that things aren't quite right, talk to your provider.
Yes.
Make an appointment, go in. You don't necessarily have to wait a year to do testing. There's
Yes.
testing that you can do that's not super invasive testing, and sometimes it's worth just looking into it and being reassured that your hormone levels are normal and everything you're doing is right, and just kind of get that support along the way.
Yes. Yes, no, it's so true. And sometimes just the stress of trying or trying too much, like you hear people, trying every day can actually be not a good thing.
No, I
It
think
decreases sperm counts. You want to really try to understand your cycle, like Dr. Dawn said, and really try to time your attempts when you're actually ovulating, and not over try.
Right. Just the stress of that alone. I think it's really hard. I mean, when we want to be pregnant, we want to be pregnant yesterday, not a year from now.
Right.
So I think it takes a toll. It takes a huge toll, and it's very stressful.
Yes.
So I think having that meeting with your healthcare provider and getting some answers earlier on to reassure you is really quite the way to go.
Yeah, and we're going to be doing a show coming up in the next couple weeks about pregnancy loss. I know that we had announced that we were going to be working with Mason's Cause, and we're going to talk to Carrie, who's the founder of Mason's Cause. She'll be on with us, and we'll be talking about pregnant miscarriage. And I know there's quite a few of you here in the chat room who've had losses, including myself, who had pregnancy losses, who've lost a baby, who's had a stillbirth. And we're going to be, even though it's not always the most fun topic to cover, it's so essential because so many of us go through this. I think 1 in 3 pregnancies end in miscarriages. Isn't that true? 1 in 3. So it's very prevalent. And as you start talking about it, you're going to see that more and more people start to mention, oh, I had a loss, or I had multiple losses.
The studies are actually showing 1 in 2.
1 in 2.
But those include chemical pregnancies,
Right.
where it's so early that a woman will
Don't
actually
even know.
have a menses.
Yeah.
And not even know.
Yeah. And sometimes you can feel like you're alone.
Yeah,
and then
definitely.
you find out what the statistics really are. So we'll be doing a show within the next couple weeks, and I think it's a really important show. Hopefully you can come back and do that one with us. That would be great. Should we have Dr. Dawn back on with us to do that show? Yeah, I think we should. I think we should definitely have her back on. Excellent. The other thing that somebody mentioned before, and I wanted to make sure that we covered it because it's on my notes and I skipped over it when we talked about the nutrients, DHA. Okay, so great point. Thank you for reminding us. DHA is definitely something that you want to be taking during pregnancy, especially in the 3rd trimesters, and during breastfeeding. 300 milligrams per day is the recommended, and you can take that through fish oil. What I definitely recommend, and I know I've talked to you guys all about this before, is when you're looking at your DHA supplement, lots of times it's in your prescription prenatal, but you want to make sure that you're not getting it from that Martech source. That's the company that makes the synthetic DHA with the hexane and the acid and the bleach. You want something that is chemical free, that is all natural, and from a fish oil, okay? Baby Bliss makes one that is made from sardines and anchovies, and it's not fishy, but it's all natural. That's the best way to get your DHA is from direct fish oils. So thank you for reminding. See, when I forget something,
It's right
they
there.
remind us.
Yeah.
I told you I have the best audience here. They keep me on my toes. All right. Another thing when it comes to getting pregnant is breastfeeding. Somebody did a question here about breastfeeding and pregnancy. So let me answer that question. Sonia from North Carolina. Okay, so Sonia said, I am breastfeeding a 10-month-old and would like to be pregnant in the next few months. I would like to continue breastfeeding through pregnancy, during pregnancy. What are your thoughts on this? Great question, because I know so many of you are breastfeeding and tandem nursing and, you know, continuing throughout your pregnancy. So I'm going to take this answer. Here's the deal. You know, when you are breastfeeding, it is an excellent form of birth control, okay, especially in the first 6 months. So don't be surprised if your body naturally will not conceive within the first 6 months after having the baby. You know, the rate of pregnancy is only about 1%.
That's with exclusive breastfeeding,
Exactly.
not supplemented
No
with formula,
supplementation.
and under 6 months.
Exactly. So under 6 months old, exclusive breastfeeding, no supplementation at all, and you cannot have gotten your period again. Once you get your period, even if you have the other two things in place, you're ovulating, you can get pregnant, okay? So most of you will not get your period for the time that you're nursing. Some of you will, and I usually see that around 6 months now. They're starting to get their periods again. More and more lately, which is a little bit concerning to me. I'm wondering if any of the hormones in the foods have anything to do that. I've seen more periods in the first year of breastfeeding now than I was seeing a decade ago,
Yeah.
which is kind of scary in some ways, and we'll talk a little bit about that. But if you are trying to conceive, most likely you'll have to wait until after 6 months because the body just won't get pregnant. Once you start the baby on solids, you'll probably get your period again, you'll start ovulating, and then you'll probably have a better chance of conceiving. It is totally fine to continue breastfeeding while you are pregnant, unless you have a severe history of recurrent miscarriages. If you start bleeding while you're breastfeeding, I mean, like if you're having while you're pregnant, there are certain things that may indicate that it may not be a good thing to do, but in most cases, it's totally fine and safe to continue breastfeeding while you're pregnant, and you'll do fine. With the exception of the sore nipples that may make it really difficult. That's one of the hardest parts about, you know, the first trimester. You will get sore, your nipples will be sore, and you'll have a baby nursing, so just be ready for that. It's one of the reasons why I love spacing the pregnancies if at all possible, okay? But it is totally safe to do that. And think about it, around the world, people are nursing toddlers, and thank God, because those children would not survive without breastfeeding long term.
It's necessary for survival.
It's necessary for survival. So perfectly fine. Yes. Let's talk a little bit for a minute about exercise. Okay.
Well, prior to pregnancy, for preconception, it's good to get into just a regular exercise pattern so that your body is used to some cardiovascular exercise, strength training, flexibility.
Yes.
During pregnancy, it's very important that your heart rate stays at or under 140 beats per minute. And the reason for that is that if it goes above 140, it diverts blood flow away from the uterus and to your vital organs. Don't ask me why the uterus is not considered to be a vital organ when filled with a baby. But,
yes, exactly.
But nevertheless, that's where your heartbeat should be. And you want to not do abdominal exercises where you're flat on your back. After 20 weeks, the uterus is of sufficient size that it compresses the big vein that brings the blood back to the heart, and your blood pressure can drop and you can feel dizzy.
Yes.
So that applies to sleeping as well. You don't want to sleep on your back after 20 weeks. So it is very important to exercise during pregnancy. It leads to a healthier pregnancy and very oftentimes an easier labor and delivery.
Yeah.
Someone had asked a question, I think, about exercise, if you could break it up into...
Oh, yeah. You know what? I didn't print that last page.
Oh, okay.
So, yeah.
So basically the question
whether we
was
can do
if 30...
15 minutes at intervals or 30 minutes was required.
Right. And the answer to that is for 30 minutes of exercise that you would have to do a day, you can break it up into 2 15s. You can break it up into 10, 10, and 10. It really has been shown that getting the exercise in, whether it's in intervals or continuous, is just as effective.
Yeah. Let's talk about weight gain for a moment.
Okay.
Okay. And also nutrition.
Okay.
Okay.
So, in terms of nutrition in pregnancy, it's really a lot of common sense and eating foods that you know are good for you, staying away from things like sugars, white flour, the simple carbohydrates, high fat foods.
Yes.
Having said that, the U.S. Department of Agriculture has put out a really nice interactive program for moms.
Yeah.
And let me get this right. It's the www.mypyramid.gov, and it's my period, my pyramid
My
moms.
period?
My period. Where my mind is. So it's my
Talking about
pyramid
periods,
moms. And then they have another great program as well where you can actually put in what you're eating,
Yeah.
and it'll evaluate if the nutrients are appropriate for you. And it does it trimester by trimester. So
Oh,
it's
it's
really
awesome.
good nutrition support
Yes.
for planning a healthy diet and making sure that you're getting a healthy diet during
Fantastic.
pregnancy.
That's great.
Yeah. Yeah.
You know, some of the things that, I want you to think about too, beyond just getting healthy nutrition, obviously fresh fruits and vegetables, getting enough protein, eating enough protein in the first trimester is actually very, very important. Some studies have shown that, not getting enough protein in the first trimester can lead to high blood pressure later on in pregnancy. And so that's something that you can't go back and correct. So you want to make sure that you're getting enough protein early on. But also beyond that, trying to eat as much organic food, especially when it comes to fruits and vegetables and your meats and your eggs. Okay, those are probably the most important things that you would want to do organic. You want to eat as little processed food as possible and try to eat as much fresh food as you can. The organics will not have the hormones, will not have the antibiotics in it, will not have the steroids or the pesticides. You want to try to avoid as much of that, obviously during pregnancy as well as when you're breastfeeding, but really all the time. And sometimes it's worth spending a little bit more for higher quality food,
Sure.
and that's especially certain things like strawberries, right? Apples are a big one, right, Joe? Strawberries, very, very bad. Okay, so if you're gonna, there's certain things that are more important to do organic than others, and apples and strawberries are two of the top ones that you want to try to avoid, as well as artificial sweeteners. And this is what drives me crazy because, and we were just talking about this before the show, when we talk about not gaining too much weight during pregnancy, and you'll have some physicians who will tell you to make sure you monitor your weight gain, don't gain too much, and so then go ahead and drink your diet sodas. And to me, gaining a little extra weight is far better than taking in artificial sweeteners like aspartame and saccharin and all these other things during pregnancy. So, if you're drinking a lot of diet soda or using a lot of artificial sweetener, I would highly recommend that you don't do that during pregnancy. It's to me one of the worst things that you can do. How about weight gain?
Weight gain. Yeah, weight gain is a very sensitive topic in pregnancy, or really for women in general.
Yeah.
And I think it's really tough. I think a lot of doctors are really, really militant about weight gain and kind of give women a hard time about it. And there are guidelines to follow. If you're a normal weight, which is a body mass index between 18 and 25, there's tables that you can use to calculate your BMI. Then 25 to 35 pounds is the recommended weight gain.
Yeah.
If you weigh a little less at the beginning, you should gain a little more.
Yep.
And if you are a little overweight, then you can stand to gain a little bit less weight during pregnancy. But I think the most important thing is not to let it affect you psychologically.
Excellent.
And not to get crazy about it. I have so many moms who are so hyper focused on their weight and how's my weight? Did I gain too much weight? Did I gain too much weight this week? And where is it all going? And what happens if I gain too much weight? And really what happens, there's a few increased risks of gaining an excessive amount of weight during pregnancy. And those would be things like diabetes and high blood pressure. But most moms do fine regardless of weight gain. The biggest issue really is that the more weight that you gain during pregnancy, the bigger baby that you have. And so the risk of having a vaginal birth and having a shoulder dystocia, having the baby get stuck, can increase. However, there are algorithms that we use where we enter information into the computer, and it's called a calm shoulder form, and it can really help us to predict who's going to have a problem with a vaginal birth. And it's really rare that there's ever going to be a problem with it.
Absolutely. Very rare. And you can also gain a lot of weight and have an easy birth like I did. So it doesn't always count, you know, it doesn't always count.
Right. And
I just didn't weigh myself, so that way I didn't know how much I was
right, and
weighing.
I had one patient that came to me.
What the hell was that?
What was that? I had one patient that came to me at the end of her pregnancy because at 39 weeks, her doctor said, "You have gained way too much weight during this pregnancy." And sort of like, well, geez, what am I going to do? I'm 39 weeks and I don't know what to do. And he sort of yelled at her. So
that's a great segue into our next comment here, our next topic, which is how to choose your provider. And what if you're not happy with your doctor? What do you do? And how, like this person, right, didn't like the way she was being spoken to.
Right.
And so what did she do? She changed doctors.
Well,
right?
she had the courage to do that. Yeah, I think when choosing a provider, it's very important to know that it's somebody that you can partner with.
Yes.
I think with pregnancy, there's different kinds of providers that you can choose. You can choose an OBGYN.
Yes.
You can choose a high-risk OBGYN.
Yes.
Although they don't do deliveries anymore. They're really just in consultation.
Yeah.
You can have a family practitioner. You can have a certified nurse midwife.
Yes,
you can have a certified midwife.
Yes.
So really, it sort of depends on what your desires are. And I think, you know, everybody interviews their pediatrician, but it's so rare to have somebody interview an OBGYN prior to a pregnancy.
That's right.
And I think it's a great chance, if you know in advance that what you want, or even if you're in the middle of a pregnancy and you're finding out that the provider is not giving you what you need. I have a lot of people who transfer to me in the middle of the pregnancy, and it's really okay to do that.
Absolutely.
I think if you are dissatisfied, or you're realizing that, you know, you're not getting what you want, once you've identified what it is that you want, then you need to do something about it, and that you don't have to be afraid. You know,
there's something about, and I've talked to so many people who are, you know, pretty strong women in their lives, you know, and then when it comes to their OBGYN, somehow they become like little girls where they're afraid, they're afraid to speak up, they're afraid to ask questions, they're afraid to say that they're not satisfied or happy with the care. And like Dr. Dawn said, and I know that this is totally how you practice, and every patient that ever comes back to talk to me after they've seen you, is that it's truly a partnership, and that's how it should be. You know, you want to make sure that you are truly in partnership with your provider. We talked about this at pretty great length a couple weeks ago when we did our VBAC C-section conversation about switching providers, and I think I said on the show that at that point that people used to transfer to me very late in the pregnancy, you know, 37, 38 weeks. As a midwife, you know, they decided this was, you know, they needed a midwife, they wanted a different type of care, and they would come and they would ask me, is it too late? And my answer would be, is the baby out?
Right.
If the baby's not out, it's not too late. And it doesn't have to be this, like, you know, very dramatic thing where you have to go get your records. You know, usually you just go to your new provider, they'll take care of your records, and you go where you feel right. You know, you don't get these experiences every day. This is your first baby, your second, whichever baby it is. It doesn't matter. They're all special, and you need to really take control of the experience so that, you know, you have what you want, right? You have what you want.
Yeah.
I think that's super, super important. And so I thought it was something that was important for us to mention there. I think we are already over time tonight. I could keep going. I mean, I could talk all night, but I think that everybody's getting tired, and it's getting late here. Dr. Dawn.
Past my bedtime.
It is definitely past Dr. Dawn's bedtime.
Knowing what my bedtime is.
I'm surprised that she's still awake right now, but she is awake. She's actually sleeping. She's good, isn't she? You wouldn't even know. You wouldn't even know. This is what it takes with two people who've spent many years of their life working 24-hour shifts and never sleeping.
You can be asleep and still function.
It was so nice to have you all back again. I'm so happy that I got to spend another hour with you. I'm so happy I got to introduce you to my best friend here, and that we got to spend time with you. Everybody say thank you, Dr. Dawn. There they go. Thank you.
Thanks for having me. It's been really fun.
We're going to have her back again. She's going to be our resident OBGYN that we will have on whenever we have questions or things that come up that we can talk about, and hopefully we'll have you back for the baby loss episode, because I think you can really help us with that. For everybody out there, have a wonderful week. It's time to say goodnight again, and I will see you next Tuesday night. In the meantime, go hug your babies, give them big kisses for me, and I love you so much. Good night, everybody. Mwah!